It will just be an answer to all our prayers.
Okay, so we're here with Belinda Naidu from Natal Settlers, and we're just going to find out a little bit about the home. And what I want to know basically is, can you tell me a little bit about Natal Settlers and what you offer to your residents and the community?
Okay. Natal Settlers was established in 1949, and we're a care facility for the elderly who are frail and semi-frail, and then we also take care of adults with disabilities, as well as children with disabilities. We provide full residential care, including 24-hour nursing care, all meals provided, transport, social activities, and nursing care as well.
And how many residents do you have, and like more or less what are their daily needs?
We currently have 350 residents. Their needs are varying and diverse. Like I said, we've got the elderly who are frail or semi-frail. We also have adults with disabilities, and we've got children with disabilities. So it's providing them with 24-hour nursing care. We provide them with all their meals. We give them we take care of them in terms of their hospital runs, trips to shopping trips. We also provide them with social interactions and programs, just to give them a more holistic service.
Sure. And when your residents currently need the attention from the nurses, how do they get that?
Okay, a lot of our residents will be provided with a manual bell that they would get to ring as and when they need to. Residents, not all our residents are frail, but those that are would be given a bell that they would ring. But it's not the ideal situation, unfortunately.
That kind of answers my next question. I was going to find out if it's very effective and what are the challenges that you are experiencing of this.
Okay, it works in the sense, it depends on proximity. So it's but it's not the ideal situation. And if they're using it, then the nurse has to be in a close proximity in order to be able to hear it and be able to respond to them. And because we're such a huge organization, and because we've got 350 residents that we take care of, it's not always possible for that system to work.
Sure. And how would having the Balmy Nurse Call system help your residents, the staff, and the home?
It will just be an answer to all our prayers. It would make nursing that much more effective. It will be allow our nurses to respond that much quicker to our residents. I think it would give our residents a sense of comfort and assurance as well, that they have a system that at a touch of a button they'll be able to get the assistance that they need. So yeah, I think it would be a dream come true. I think it would make quite a difference generally in terms of the care of that frail person, and give them the assurance, give family an assurance as well. That would be a huge thing for the home and for the residents.
Have you ever had an incident where if you had a nurse call system it would have been a different outcome?
Unfortunately, yes. We have had a few accidents. A person, our residents are very fragile and could fall quite easily. And it's, if we had a system where they would call for help immediately, and it definitely gets to the duty room, then the response time would be a lot quicker. So yeah, it definitely would be a benefit to us.
Sure. Can you tell us a bit about how you make your ends meet every month and why it's so hard for you to afford the system on your own?
Okay, the main thing that I need to put out there is that we provide a service and we strive to be as affordable as possible to the man on the street. As you heard, we provide 24-hour nursing care, frail care, and we try as much as possible to keep our costs as low as possible. So if you compare us to what frail care costs in KZN or in South Africa, we're on the lower end of that spectrum. So we rely on a portion of the income that we get is from the government. So we get a subsidy from the Department of Social Development, but that is specific to a particular resident. So they need to be assessed and they need to meet the criteria, and that's how we would get income from that. We use a portion of the older person's pension that goes towards the cost of their care, and then we rely on families to cover the shortfall. And that's where the challenge comes in, because not all families are able to afford that. And right now we're sitting on a majority of our staff, of our residents on baseline, where that shortfall is not being met, and that's what's putting the strain on the organization.
Sure.
We do hold fundraising events. We do make appeals to donors and different funders in order for us to be able to balance that gap and to be able to provide the service that we do. So right now, with the resources that we have, we strive to provide the basic care. We strive to make sure that they have their meals, that they're making their hospital appointments, that they have a nurse to oversee their care. But it doesn't necessarily mean that we have the means to provide assistive devices and resources like a family service that would provide.
And then what are you guys doing from Natal Settlers' side to basically acquire the system? Like, what can you guys do to get the public to assist you?
The only thing we could do is do proposals or do funding appeals. And, when we do get, if we do approach a funder and money comes in specifically for that, then that's what we'll use the money for. Recently, we got a funder that took care of the fire alarm system, which is such an essential thing for a frail care center. But that wasn't possible without the funding. So the funder made that possible for us. So that's what we will continue to do, to approach different trusts, foundation, corporate, in order to provide the funding for that specific need.
And then why should, if you had to say why people should support Natal Settlers and contribute and donate, what would make them want to do that?
Because you could be saving a life. And in this case, you could be saving 350 lives. It's a simple thing, it's a simple tool, but it's somebody's lifeline. It could be somebody's lifeline. So if somebody wants to contribute, that's basically what it will be for. It could inadvertently be saving somebody's life. That's how simple it is.
The last question is just, do you have anything that you would like to say to the public and possible donors?
Okay, we provide a valuable service. It's taking care of those that are unable to afford the luxury retirement villages and the gated estates. It's providing essential care for those that need it the most. Somebody who's only on their pension and be able to get a little bit of support from family, we'll be able to provide them with a forever home. We'll be able to make sure that their last years or their last years are lived with dignity, rather than just living or trying to make ends meet out there on your own. We provide the support. It's a communal living, and it just gives them the social context for them to see their days through.
Why do you do what you do?
Just passion and people, and because it's needed. It's seriously needed, and these are vulnerable people that are sometimes forgotten. And unfortunately, you need a place like this, you need an organization like this that's going to be able to take care of those people and give them dignity, give them hope, give them comfort. And sometimes we get people that come here just so that they're ready to pass on, and we got to make that as dignified as possible and make that as comfortable as possible for them. It's just passionate people and wanting to take care of people. So why am I here? Why am I doing this? I'm a social worker, studied social work, and so social work and people are my passion, and the disabled as well. Disability as a sector. But just generally, I'm here for 5 years. I was approached to apply for this job, and it took all of me to come here because I was in a comfortable position. I was a director at Blind and Deaf Society, and I came here basically to do that, to make that difference, to put heart into the work that we're doing, to get staff motivated, to get people thinking of the person you're caring for, not the job. Yes. You hear what I'm saying? That the person is the center of what we're doing in everything that we're doing. Whether you're doing nursing or whether you're doing finance here, it's all about that person. And to get people to think that that is the most critical thing. And everything around it has to be centered around that particular person. And that's what we're doing. 5 years on, and I'm still fighting the fight, and I'm still continuing with it. And we had a nursing college that was bringing in, and that's what the important part was, that we were able to provide the service at that minimal rate. And I'm talking, like, you know, our baseline would be 4,500 rands, and out there for free, okay, you're paying 10,000, 12,000, 15,000 rand. And we were able to do that because we were running a very successful nursing program, nursing college, and that brought in 1.2 million rands a year. And recently, the legislation changed, and we lost that. And then last year, this time, we were sitting in a crisis situation where we either had to close. No, I had to call my staff and say to them, listen, we need to shut down, and the residents need to find a new place to live. And it was a critical breaking point. And we've managed to turn that around. We've managed to realign everything we've done, and we've managed to basically come through the year, and our doors are still open. So now we're fighting to keep it open, and we're fighting to make it happen.
How did you turn that around?
A lot of hard work. We literally got practical with every item, every cent that left this home. We took away the middleman. In buying vegetables, we go directly to the market on a 6 o'clock on a Tuesday morning and buy that, and that saved us like 13 to 15,000 rands a month. We, as our numbers reduced, staff left, we were restructuring to manage with the staff that we had rather than appointing. We had meetings with all our suppliers and basically painted the picture for them and said, come on board and support, and they were phenomenal. A lot of our suppliers came on board, reduced costs, gave us payment breaks, all those things, and that's how we did it. And we ended this financial year in a surplus rather than a deficit, and that was a big win for us. But now we're working hard to sustain that, going forward. So yeah, that's
amazing.